one of the biggest pushbacks I get from folks that want to get their wisdom teeth out or need to have their wisdom teeth out or have a question about having their wisdom teeth out is, why do I need a consultation before I have my surgery? And the first thing I would pose to you would be this. Would you go have your knee operated on? Would you have heart surgery? Would you have brain surgery? Would you have surgery on any part of your body without talking to the surgeon, meeting the surgeon, and having the opportunity to ask questions? I think the answer would be no. And this is no different. People tend to think that this surgery is minor. Well, there's no such thing as minor surgeries in my book. They're all major surgeries, especially if you're working on me. So the fact that I request people to come in for a surgical consultation is really for you to get to know me, for me to understand what your situation is. Everyone is unique. Your medical history is unique. Your family medical history is unique. Your experiences with dentistry and surgery are all different. Your surgical cases, your position of your wisdom teeth may be different than somebody else's. Your experiences are all unique to you. And you have questions that a lot of people ask, but you may have a special question that I haven't heard from another patient that I would like to address with you. So really, it is a way to get to know you. You get to know me and my team, where you come in for surgery the day of your actual procedure. It's not foreign to you. It's not something that you're more stressed about because you really don't know what's going to happen, who's going to be doing it, the process. We're going to go over all that in the surgical consultation. Another part of that is finances. These surgeries, we're dealing with insurance companies. We would like to try and give you more detailed information or a better estimate on your out-of-pocket cost when it comes to surgery. And a lot of times you can't do that in the same day because it requires us to make a phone call or to send off a paperwork to your insurance company to get a predetermination. And I know convenience-wise, we're all short on time. Look, I have 4 kids that are all in different sports: swimmers, baseball players, soccer players. We're all short on time. So we don't want to spend an extra, 45 minutes, hour having a consult and then having to come back and schedule a surgery at a different date. I understand that. But it's still important to me for you to come in to do the surgical consult, and it makes sense to me. I wouldn't want to go in, sit down in a chair, meet somebody for 5 minutes, and then start putting me to sleep and doing surgery on me. I just don't think that's a great idea. That's me. You can find other surgeons that do it differently. And I'm fine with that. I don't have a problem with it. If they're comfortable with it and you're comfortable with it and that's something that you want to do, by all means, that's for you to choose. But I think a consult's important. And I think that it's something that does improve your experience when it comes to surgery, because nobody wants to be here and nobody wants to get this done. At least we can come in and we can put your mind at ease, tell you what's going to happen, how it's going to happen. At least you'll have the facts and the details before it actually occurs. And we're not just going to slam you in a chair and go to work. I hope that answers your question. If you got more specifics on that, you can give my office a call, or you can schedule a consult, because that's the way we start over here in my office and in my practices. I like to do that consult first, and then we can talk about, sometimes you don't even need surgery, so you definitely want to have that consult first. You can schedule by requesting your consult on the website on one of the big orange buttons, and we can get the form in here and we'll give you a shout and we'll get that set up. Thanks.